The skin is the largest organ of the human body. It functions to protect our body systems and its underlying tissues from the harmful elements of the external environment. One of the most visible and exposed skin is on our face. Thus, a skin that is unhealthy will not just affect our physical appearance. More importantly, it can also affect our social and psychological behavior. One of the major skin problems we commonly encounter is acne, more commonly known as pimples or zits. Acne is a chronic skin disorder that affects nearly 80% of adolescents and young adults between the ages of 11 and 30. In most cases, acne begins around puberty. However, it can persist into the late 20s or 30s and beyond. It normally appears in the face, back, chest, and shoulders. It is very important that we understand what acne is, its causes and symptoms, so that we will know how to prevent and properly treat it. Acne is a chronic inflammatory disorder of the pilosebaceous unit. The pilosebaceous unit is made up of the hair follicle, sebaceous glands, and sebaceous ducts. Our normal skin is made of the hair follicle, which grows through the follicular canal. Attached to the canal is the sebaceous duct, which leads to the relatively large sebaceous glands. These glands are responsible for producing oily substance known as sebum. The hair follicle in our skin is made up of keratinocytes, which under normal condition proliferates and sheds off corneocytes, or the dead skin cells. It is this process, which is known as keratinization, that is impaired for the person suffering from acne. Acne is a multifactorial disease. Acne begins with the clogging of the pores. The dead skin cells shed off into the follicular canal, where they remain intact and adhere to each other. With time, a solid mass forms, which readily expands to result in the formation of the microcomedo, that is the start of all acne lesions. The microcomedo appears to be invisible to the naked eye, but detectable through histological techniques. Another factor that causes acne is increased sebum production. Acne develops during puberty, when the sebaceous glands become very active due to androgenic stimulation. This leads to overproduction of sebum, which accumulates in the blocked follicle and contributes to the formation of closed comedones, or whiteheads. Once the plug in the pores gets big enough to be seen, blackheads or open comedones occurs. A bacteria known as P. acnes, which digests oil as its nutrient, multiplies within the obstructed pores and consequently releases a variety of extracellular factors, which causes inflammation. Inflammatory acne lesions are eventually developed, such as papules, pustules, nodules, and in the most severe cases, cysts. Acne can be triggered by a lot of factors. Male sex hormones called androgens actively increases in both male and female during puberty. More androgens lead to the enlargement of sebaceous glands, which means more sebum is produced, leading to additional clogging of the pores, subsequently forming acne. Another factor related to acne is genetics. The tendency to develop acne can be inherited from parents. Hormone levels in girls and women may cause acne to worsen 2 to 7 days before their menstrual period starts. Stress, especially severe or prolonged emotional tension, may also worsen acne. Pinching, pricking, and squeezing your acne may cause them to get worse. Washing too often using harsh soaps may also irritate the skin and cause acne to get worse. Acne can be treated, but it does not go away overnight. Treatment usually takes 4 to 8 weeks before you can see a change in your skin. There are a number of medicines which may be used. Now that we understand the multiple factors which cause acne, it's also important that we know what are the different treatment options to address acne. There are classes of drugs, both topically and systemically, that can influence the different factors of acne, like inflammation, bacterial P. acnes, abnormal shedding of the cells, or comedogenesis can influence the overproduction of sebum in the sebaceous glands. Using these medicines in combination will give you faster and greater treatment outcome because you target more factors of acne. Your dermatologist may recommend one or more medicines depending on your acne severity. Topical retinoids such as adapalene is essential in the treatment of acne. It is the ideal first-line treatment for mild to moderate inflammatory acne because it has a powerful keratolytic effect and a potent anti-inflammatory action. It normalizes cell differentiation and keratinization. Once follicular turnover has been normalized, it will eliminate the plug and enhance drainage of sebum in the follicle. It acts rapidly by targeting the microcomedone, penetrating the site of infection within 5 minutes after application. Research has shown that the novel adapalene with the correct microparticle size selectively penetrates the follicular duct right into the target site of acne. Other adapalene with microparticle size larger than 10 micrometers does not penetrate into the target site of acne and remains only on the skin surface, while those with microparticle size less than 3 micrometers are randomly distributed on the skin. Third-generation retinoid exhibits good tolerability and safety profile. It minimizes the problems of irritation, such as redness and scaling during treatment, leading to better patient compliance and resulting to a clear, acne-free skin. Since acne is a chronic disease and recurrence is a common problem, it is a must to continue on maintenance therapy with a well-tolerated topical retinoid. Adapalene is ideal for long-term maintenance because it targets the root cause of acne, or microcomedone, thereby preventing new acne lesions from forming. It is also ideal in combination with other antimicrobial, like benzoyl peroxide, because it is chemically stable and provides faster and greater reduction of acne lesions. It can also be used in combination with topical or oral antibiotics with high safety profile because it provides greater efficacy. Now that we know the science of our skin, it would be easier for us to treat and prevent acne. Remember, medications don't work if you don't use it properly. Follow your dermatologist's recommendation in caring for your skin. It's your best chance to control and prevent acne.